Okay, welcome to the video this week, and thanks for watching. We have a special guest on here today, which is my friend and neighbor, Bre Stoddard. And Bre, how's it going today?
I'm doing well, Dr. Williams. Thanks for having me on.
Yeah, absolutely. So Bre is a PA at Lone Peak Hospital in Draper, part of the Mountain Star Health System, and we brought her on today. Obviously, there's a lot of change happening right now in the world, and especially in healthcare. So we brought Bre on. She's not only a PA, but she and her husband, they're avid outdoors people. And so when I want to know all the cool places to go hike and camp, we call Bre so she can tell us all about it. So tell us a little bit about yourself, Bre. Anything else I didn't cover?
You covered the high points. So as you said, I'm a physician assistant. I work in family practice, and our clinic is an outpatient clinic at Lone Peak Hospital called Lone Peak Family Health. And I've been working in family practice for 11, almost 12 years now.
Cool.
And I also did a little bit of OBGYN for a year, and otherwise it's been pretty strictly family practice. We've enjoyed being over at the hospital with a lot of access to extra ancillaries and good equipment and ER, and so it's been a great change. We've been there for a couple of years, and like you said, I really do enjoy the outdoors. That's where I want to be if I have any free time, mountain biking or hiking, and I think it's the best way to stay well.
Yeah, and I keep saying, at least it could be worse, where if COVID would have hit us in the middle of January, it might have been a little gloomier. So at least it's springtime in the U.S. so that we can be outside and get kids out and go
Have
for a walk or a hike or get to the mountains.
Yeah.
So that's great. So, cool thing with Bre too is, she's a good resource for us here because we screen a lot of sleep apnea patients. We find a lot of patients who have worn teeth or acid reflux or narrow mouths. We see a lot of those that have a high likelihood of sleep apnea. So Bre's a great resource because we can send patients to you, and you can do full workup and screening to diagnose if and what type of sleep disorder they may have. So that's really helpful for us too. But, you mentioned, 11 or 12 years. Have you seen anything, until now that's been like as much of a shocker or as drastic a change in the healthcare system as COVID is in the, over a decade you've been in practice?
No, nothing close. In fact, I've even spoken with some of our senior physicians who are over 65 and say the same thing. We've never seen anything like this.
Mm-hmm.
I guess I should say we've seen pneumonia. We've seen illness that is similar to this, but we have not seen it at this scale. We haven't seen it impact the everyday and impact society as much as it has, and really impact our way of practice as much as it has.
Right. Big changes. And I think, my perspective has been is, there may be some aspects of it that are, affecting us too much or maybe too worrisome. But I think in the long run, we'll probably be a little smarter when flu season comes around next year, and maybe we'll be better about washing our hands and not taking our kids to the movie theater if they have a cough, or a little more social distance. I think hopefully there's some good things that come from that. But what right now, what changes if someone came in to see you for an annual physical, they have a cold, maybe even COVID, what kind of changes would they expect so far in the hospital, as different than maybe even they were a couple months ago?
Well, so the very first big change is that anyone who calls with symptoms of COVID, we are directing to a drive-through clinic to be screened. And rather than coming in to our clinic, If they have mild to moderate symptoms, we're encouraging them to be tested in a drive-through screening, and then stay home and isolate themselves. So we actually don't see too many of the mild to moderate cases. Any of the severe cases, we do ask that they go to the ER for admittance into the hospital, and then they're tested in the hospital rather than through a drive-through site. We certainly still see a handful of sick patients every day. And so what that looks like is, as soon as the patient walks into the hospital doors, they're immediately screened with a temperature and a thermometer, have their temperature checked. And if they have any temp over 100, they're given a mask. Mm-hmm. And then we are informed. And really, though, I guess even this week, every patient is getting a mask, regardless of whether they have a temperature or not. So once they get into our office, they're given a mask, and they're immediately escorted back into a room so that they are not sitting in the waiting room, touching any of the community chairs in the waiting room. And then in the room itself, if they have any symptoms of COVID, which, as we've all been told them several times, but cough, shortness of breath, fever, which is anything over 100, sore throat is now included, body aches and chills, and any loss of smell or taste is now included. So any of those symptoms, then they would expect to see us walk in full gear with mask and
full hazmat suit.
Yeah, exactly.
The nuclear bomb
looking kind of scary. Yeah. You can barely see
right.
faces, covered in a yellow gown and gloves, and we try to maintain as much distance except for the actual exam as possible, and then still will likely refer to a testing site at that point. And so, like I say, we've seen a handful of patients each day with this whole screening process. But if that is the case, that somebody comes in sick, then that's what they would expect to see. And then all the other patients will be given a mask, and they would expect to still see us wearing a mask and goggles for every patient. Yeah.
So that's so even if I'm coming in for my annual physical or something, I'm still going to be given a mask while I'm in there just to. Cool.
Yeah. And so we're actually doing a lot of telemedicine as well. That's virtual medicine where we can use audio visual to go over many things. I would say there are several medical conditions that can be evaluated via telemedicine. And so we're encouraging all of our high-risk patients to be seen via telemedicine. And then anyone else who's just not comfortable coming in can be evaluated. Right. Telemedicine.
So if I'm diabetic, or I have a history of a lot of heart disease or something, then I may be better off just doing telemedicine for now, at least until things die down a little bit.
Yes. Yeah.
And we actually set up a teledentistry portal.
Oh, really?
We set it up last November, actually, because we joke, and it's unfortunate, is that if it's a holiday weekend or your birthday or your kid's soccer game, that's when you're going to break your tooth, And so last Thanksgiving, we set something up because we just could see a trend happening. So fortunately, that helped us through this, where we had that available. And even though, most things we do still require in-office treatment, at least we can kind of do some preliminary work, or maybe start an antibiotic if we need to or something.
Oh,
I think it'll just get better and better. But that's just one of the changes, we didn't foresee that, that we're doing already is, patients are calling us when they get here. We're sending consent forms to their mobile device or their tablet just to try to minimize the number of pens that move around. Just all those kind of things that I think initially I didn't think of, and now we're learning on the fly. And obviously there's still a lot to be determined of what the final regulations and rules will be on what's required in the long run, which will be interesting to see.
Yeah, well, and as many people have said, they didn't realize how many times they touched their face until they were told not to. They didn't realize how
Yeah,
many times they touch things that are community touched until they're told not to. And I think you're right. That's going to really be an eye opener for a lot of people about, a lot of people will come in and ask me, well, why am I getting sick so often? And I think this is really showing people why, how much contact we have with everyone else via these kind of shared doorknobs and pens
mm,
and that sort of thing. And so not that I want people to become germaphobes,
right,
because
right.
I think that there's a certain level of anxiety that can come from being very nervous about this in the general time period. Certainly COVID is a little bit different. So I think it's good to be aware, but not to be overly anxious
Yeah,
in the future going forward, hopefully.
right, right. You got, everybody's got to roll around in the dirt a little bit, so to
Well, and
speak.
it
But
builds immunity. There's
yeah,
no other way to really become immune to things without being exposed or unless you have a vaccine. But yeah, I think it's important too that we're seeing that there are people who are a lot more susceptible and a lot
mm-hmm,
more high risk and at risk for bad complications from illness that maybe we don't feel or we don't see with our own families. But we can recognize how what we do is impacting them via all these things that we share.
absolutely. Yeah, and I think I'm grateful that we practice in Utah, because Utah's been, seems overall the hospitals didn't have as many cases as were anticipated, and the governor got things going. I mean, we were open the whole time during the kind of the peak, quarantine COVID time, but we were limited on procedures. But, as of a week ago, governor said, hey, you can pretty well do anything in your dental practice. And, I have friends and colleagues in other states that are kind of envious right now because not everybody's quite there yet. So I think we're hopefully in a good spot. But, question I have for you is, as we're shifting now, we got, allergy season coming, spring, summer. Are we, are there things that viewers should be looking out for, preparing for that? Because I wonder if, with so much focus on COVID, if maybe other things have been pushed aside or neglected.
Yeah. Allergies are actually going to be pretty tricky, I think, and have been tricky for people because the symptoms can overlap, especially a dry cough. Allergy can definitely give you a dry cough. So,
and right now, if I cough from allergies, everybody's going to stare at me and think I have COVID and
right.
tell me to get away.
Might as well just run away because nobody wants you around. The cough that comes with allergies is usually going to be associated with sneezing and itchy eyes and runny nose. So that gives you a little bit of a clue too as to what it might be. But given the circumstances of the times, I do think that if you have a new dry cough, you should still probably go and be tested for COVID. But if you are fairly convinced that it's allergies, there are a few things that are helpful that are over the counter, or you can come in and be evaluated in clinic. One thing that I like to tell people to use is Flonase, which is over the counter. The ENT community really recommends this as first line because it is specific to the allergies in the nose and not going to affect your whole body the way that like an allergy, oral allergy.
Gotcha.
But I think that Flonase is not highly favored, and that might be because people don't quite understand how to use it. So my biggest tip would be on the use of any nasal spray, but Flonase is the one that's over the counter, so it's the easiest to obtain. But the nozzle goes into your nostril and you aim it towards the ear of that same nostril. So
All
out the
right.
back, away from your septum. And then you spray it and just breathe it in gently. Don't suck it in. It will go down the back of your throat. And then you spray it again. So 2 sprays on each side once a day. And don't expect it to work immediately. It won't. It does take a week or 2 before you start to feel an improvement. I do caution people, there is medication out there that can actually cause you to be dependent on it. So like Afrin, that is a nasal spray as well. But if you use it for more than 3 days, then you will oftentimes get congestion purely from not using it. So you're kind of stuck to using it. So I do tell people, if you're really, really miserable with your runny nose that's probably draining post-nasally and causing your cough, you can use Afrin with your Flonase for 3 days, help dry things up, and then try to stick with your Flonase beyond that. And if that's still not controlling it, I think a good tip is that Zyrtec is at Costco for 365 pills at, I believe, $13 or so the
Cool.
last time I checked. So that's also another good one to pick up. You can get that fairly cheap, and it's effective. More effective.
That's good. I didn't know about the Flonase. You know, I haven't used it before, but that's good to know, because I wouldn't have known. You know, I'm just the type that I just want to grab the box and use it when I'm ready, you know.
Yeah.
Like patients will say, hey, you know, sometimes go, hey, you've done this procedure before, right? Kind of jokingly. And so we'll joke back and say, yeah, I read the instructions just before you got here, you know. But you know, that's good to know. You got to tip it out, because, you know, that's just the kind of thing where you could get frustrated.
Yeah.
Like you just got to throw it away, and really you just didn't put it where it needs to go.
Yeah, and it will start to cause nosebleeds, and so that people will say, I can't use Flonase, it gives me nosebleeds, and that's probably because they're aiming at their septum.
Gotcha. Well, that's good. You know, and if you're watching this and you're having allergies, go see Bre, because we get a lot of people who end up on lots of steroids, especially like inhaler types, and they get frustrated because they're always getting cavities and root canals and broken teeth. And we treat a lot of dry mouth as a side effect from different, you know, a lot of steroids, all types of prescriptions. But anyway, like you were saying, is, you know, if someone can come and see you sooner, they may have more options of over-the-counter versus prescribed things they can take before they maybe get too dependent or more congested from using the wrong thing. So
yeah, well, and a comment on that. I didn't, you know, I certainly don't realize all of the repercussions that you're seeing with these steroids, and I think part of that could be another tip is anybody using a steroid that is inhaled should be rinsing their mouth out with water and spitting that out after each use to just get all that steroid out of their mouth. Cool.
Yeah, that's good. That's good. I'm gonna remember to remind all of our patients about that. So
yeah, I guess by the time you're seeing them, it's kind of late.
Yeah, but a lot of them will have it in their bag or something when they get here, you know. So that's a great reminder. But well, cool. Well, Bre, thanks so much for being on. Any final tips today, or anything else you think you'd share with our viewers? And then just let them know how they can contact you. We have a number of patients who have either moved or, you know, they don't have a regular physician's office they see, so you could be a great resource. So let us know how they can get in touch with you as well.
Yeah, you know, I think that my biggest tip would just be working to stay well by staying active, trying to get enough sleep, eating well, eating plenty of fruits and vegetables, drinking water, and for a lot of us that's easier said than done. Yeah. But I do think that if you can make it a priority, you should. Yeah. And
it's like the best, we like to say the best, you know, it's like the sports analogy, the best offense is a good defense. So rather than worrying about, you know, all the drugs I may need to take, if I can just keep my body well regulated, I'll have a better chance of, even if I did get COVID, hopefully I would kick it quicker. Or do you agree with that?
Yeah, I mean, I'm asked all the time, how can I boost my immunity? And there are all sorts of products out there that tout immune boosting capabilities that really haven't been proven. And so
Right.
the best way to keep your body healthy is all of the things that you've been taught your whole life about sleep and eating well and exercise and the things that are hard, the hard things to
Hmm.
fit in and the hard things to maintain, but they're what will benefit the most overall. So
Great.
yeah.
Well,
And
perfect. Well, yeah. How can if someone has a question or maybe they need to make an appointment, how would they get in touch with your office?
so our office is Lone Peak Family Health, and you can schedule an appointment online at Lone Peak, I'm just reminding myself, lonepeakfamilyhealth.com. And then our
Cool.
phone number is 801-545-8480.
Awesome. Great. Well, thanks so much. And like we said earlier, is a lot of our patients who may have sleep apnea, um, or we've screened. Bre's a good, a wonderful resource we can send you to as well. And you can check the bottom of this video with some links to our number. If you have questions, you can get in touch with us as well. So thanks so much, Bre, for being on. You're a wealth of knowledge. Lots of great tips there. I took some great notes. So thanks for being here today.
Thanks for having me, Dr. Williams. We'll
All
talk
right.
to you soon.
Okay, thanks. See ya.